Welcome back to my channel. Welcome back, viewers. Thank you so much for tuning in. Today's topic, I'm going to talk to you about a few ways in which racism can present itself in social work in our field. I've seen a few articles online talking about racism, but I'm just going to share with you a few nuggets of my own observations or of my own thinking in terms of how racism can present itself in social work. You will find that most of my nuggets or points that I'm going to be sharing here are derived from my experience as a children's practitioner or as a social worker who works with children and families. I don't know whether it's going to be applicable to somebody who works with adults or somebody who works in mental health or another field, but you might find that these points may actually cross-exchange or might be applicable in other fields as well. So I'm going to share with you a few of my views and thoughts in terms of how racism prevents or how racism presents itself in social work field. First and foremost, let me put a disclaimer. I'm not a guru in social work, but I share nuggets from my own experience, from my own practice, and from my interactions with colleagues in the field, etc. If you are new to the channel, please do subscribe, hit that notification bell so that when I post, you'll be the first person to be notified. Also, hit that like button so that the more likes the channel gets, the more subscribers the channel gets. It helps us to actually improve in terms of the quality of our videos, the editing part of it, and all that. Let me dive straight into it. First and foremost, point number one in terms of how racism can present itself in our field is inadequate advocacy. What do I mean by this? Failure to actively address and challenge systemic racism within the social work system or within the social work field. That's inadequate advocacy. You might find that some places or some employers might come up with policies which they think might help to improve issues around the racism, but these cannot be sustained for a longer period of time. This contributes to what I would call inadequate advocacy, or to an extent that when issues to do with racism are challenged at the workplace, nothing happens after that. It's just challenged to an extent and then it just fizzles out and nothing comes out of it. Right. Point number two. The other one is colorblind policies. I don't know whether this is applicable in agencies. I'm not going to give examples, but I'm just going to give points as they are, as I know or as I've discussed with colleagues and alike. So if agencies or employers ignore the impact of race on policy development, this may easily perpetuate systemic inequalities. What do I mean by this? If issues to do with race are not inculcated in policy development, then it is easy for issues to do with racism and systemic inequalities to be perpetuated in the community or in the communities that we serve or in the agencies that we work in. So that's another very, very important point as well to take note of. This one, point number three, is really, really crucial for me because I've seen it happening in a few agencies that I've worked in, or I've seen such kind of things happening in other places of work. I've read about it on TV. I've seen it, or I've read about it in newspapers. I've seen it on TV. That's unequal resource allocation. What do I mean by unequal resource allocation? So if you look at it, for example, let me give an example of a community where we would say, let's divide the number of social workers that we have to make sure that they deal with a specific community. And then in those allocations, you might be someone might be allocated to a community which has got 5,000 people, or another team might be allocated to a community which has got 20,000 people. The other team might be allocated to a community which has got 1,000 people. So if you look at it, there's no equal resource allocation when it comes to that, especially if you're saying the same number of people saving 1,000 people would be the same number of people saving 5,000, would be the same number of people saving 19,000 or 20,000 people. That unequal resource allocation may easily lead to a situation where the resources are distributed unevenly, and it perpetuates disparities among communities that you are serving. That's another point to take note of as well. So if you see an example where a local authority has got, say, is divided into 4 areas, for example, and you are given an equal amount of teams to save those 4 equal areas, that's already, we should question that already, because there's a big question mark around that, because all those 4 areas are not saving the same number of people. So why would you put the same number of teams to save 4 different places? Divide the teams equally amongst those 4 places. It means that one team is very busy as compared to the other team, or the other team might be less busy as compared to the other team, which is serving a bigger population. So that leads to burnout of staff members. That leads to sometimes assessments which are rushed, which are hurried, because people have got lots of work to do. So that's self-explanatory. Unequal resource allocation usually leads to an uneven distribution of resources on the ground, because if you unevenly distribute the number of teams to deal with those people, it means also the resources that you're going to be allocating to those teams might also be uneven, and that perpetuates disparities amongst the communities that you are serving. So for policymakers, for directors out there, for people in power, that's really important. It's food for thought. You need to think about it. If a page which is covered by a team of 5 social work teams is the same with a page cover with another page where you've got 5 equal teams as well, but the population is different, that should give you some food for thought to think about. Are we distributing our resources evenly? Are we distributing our resources equitably within the community? You need to think about that. There's nothing wrong in ensuring that, because a team which is serving a population of 5,000 can have 3 teams. A team which is serving a population of 20,000 can have 10 teams. There's nothing wrong with that. At least you are making sure that in terms of a ratio of social worker to the population, you are making sure that you are distributing the resources equitably in terms of staff members. Right, there is what we call also tokenism, where there is an occasional inclusion of individuals from minority backgrounds without addressing the systemic issues within the organization. That's really important. For some agencies, you will hear them saying, oh, we've got a director who is from the minority background. Okay, fine, that's good, but what is it that you've done to address the systemic racial inequalities within the agency? Or what is it that you have done to address the systemic issues which are there within the agency? It's good that you have recruited from ethnic minority backgrounds, but you need to actually take it a step further and actually also address the disparities which are there in terms of resource allocation, the things that these people from minority backgrounds are actually advocating for, or are actually advising, to make sure that they are done. Right. The next point, which will be point number 5, is if your staff has got limited cultural competence training, we all know already that it leads to issues in the community. It may result in ineffective support being given to our diverse populations. So you need to make sure that cultural competence training is a mandatory training for staff members, and it's a requirement for staff members when they join, so that in terms of delivering the support that we need, it's effective, and it actually addresses the challenges that we find in the diverse populations that we serve as local authorities or as social workers. Point number 6, I'm talking about implicit bias. What do I mean by implicit bias? Bias is where social workers' perceptions and interactions with clients might actually impact service outcome. I'm not going to expand much on that, but we all know that to an extent we've got biases that we hold against certain populations, or we may have biases that we hold against certain people from other backgrounds. And if those biases are not challenged, it's easy for them to influence how you serve that particular population as well. Point number 7. Let's talk about disproportionate interventions. Disproportionate interventions, talking about situations where we put a blanket use of our thresholds to communities, including those from diverse backgrounds, or including those from minority backgrounds who may not necessarily primarily be accustomed to the expectations that we have as professionals, right? Um, so, this influences decisions, especially when it comes to removing children from families. So we also need to take into account the background of the family that we are dealing with. What is it that they are accustomed to? When you talk about physical chastisement, is it an issue of them knowing that it's not good for them or it's not good for the children, but they still continue to do it, or is it an issue of them being accustomed or being brought up in a different setting or in a different environment in a different country, and then coming to England, these things are new to them. So sometimes it's about educating them rather than taking the most stern measure of escalating a case to legal planning meeting and all those kind of things before you have make sure that you've exhausted all avenues possible for you to support this family or to deal with this issue at a statutory level where you are, or at another level where the parents are able to actually engage with you, especially when there is good engagement from this particular family. There may not necessarily be reasons for us to actually be escalating some of these cases. We need to take note of that. And then racial profiling. I'm not going to talk much about the racial profiling. I'm sure you've seen it on TV, you've read about it. But certain racial and ethnic groups may be unfairly targeted or scrutinized based on preconceived ideas or based on preconceived stereotypes that we have concerning people from certain ethnic backgrounds, right? Um, the other point, which is also a very crucial point, possibly point number 8, is language barrier. And where there is a language barrier, especially when we are working with populations from ethnic minorities, it's important to make sure that you make use of translators, because if you do not, and it may lead to insufficient support to them because you don't have a proper understanding of what's going on. You don't have a proper appreciation of what they are going through. It may lead to insufficient support. And what happens when there is insufficient support? It can hinder, their engagement, because they are seeing you as somebody who is coming to help them, but because you haven't actually appreciated what they are going through, you may not actually effectively help them to their expectation, and then at the end of the day, that hampers their ability to actually engage with you in the long term. So you need to make sure that when you go out to those families where you know that there's a language barrier, make use of an interpreter and try to be as culturally competent as you can be when you are engaging such children, when you are engaging with such families. And then microaggressions. This is quite interesting because often unintentional and discriminatory remarks that can be made or behaviors that may occur in your interactions, day-to-day interactions with clients, that happens subconsciously, which may lead to sometimes service users withdrawing information or putting a wall between you and them, and making sure that they won't engage with you properly going forward. So you need to be mindful about microaggressions as well. Point number 9, which is also important, this is linked to another point which I spoke about earlier on, point number 3, where I spoke about, or point number 4, where I spoke about tokenism. So this is limited representation. It's linked with tokenism. So if you have got underrepresentation of minorities in the top hierarchy, it may mean that the decisions which are made at that level may not necessarily be commensurate with the expectations of the population that you are serving. I hope I'm making sense there, and I hope you're understanding exactly what I mean. If if you're serving a bigger population or a bigger diverse population from ethnic minority backgrounds, that would be, say, for example, that would be 3/4 of the population that you serve. But the decision makers who are making decisions for this population are not from that particular ethnic group. It's easy for those decisions that are made to actually not be commensurate with their expectations. It also hinders, our ability to be culturally competent to an extent. So we need to be mindful about that. Then point number 10, point number 10, bad or biased decision making. Biased decision making. Prejudice to an extent does influence decision making, and it also impacts on allocation of resources and support. I gave an example earlier on to say when you have a population of 10,000 people in a particular page in the town being saved by the same number of team or 5 teams or 6 teams or 7 teams, and you've got 7 teams also saving a different page of the population, another town of the part of the town, but saving 5,000 people, there are already disparities there. It may mean that the social worker in the other area is only dealing with about 10 children, but the social worker in area X is dealing with 25 children. That's just unfair. And we all know what happens when it comes to that. There's burnout for that particular group of social workers, and the other particular group of social workers are actually enjoying work. They are having quality time with their service users. They're able to progress their work on time. They are always meeting deadlines and all those kind of things. So in as much as people articulate these things, we need to be mindful as policy planners, as decision makers, we need to think deeply about how these things impact not only our staff, but also it impacts the families that they are serving. And it's actually a chain reaction if you want to see it. If the staff members are actually impacted, how does that impact the service users whom they are serving on a daily basis? So we need to be mindful about that, and we need to think about that, and we need to think, we need to look into the bigger picture of how these things impact, our service users. And, at the end of the day, if it impacts them, there is also bad feedback which comes to us as an agency, and at the end of the day, it actually affects our own rating as an organization as well. The last point is disparities in service access. So by this point, what I mean is certain racial and ethnic groups may face barriers or unequal access to social services. I think the same example which I gave earlier on is also applicable when it comes to disparities in service access. To an extent that, let me give you an example. I gave an example earlier on where if you've got a population of about 20,000 people in a particular page, and a population of 5,000 in a particular page being saved by the same number of social workers or the same number of teams, it means that the response time in a page where you've got 20,000 people may not necessarily be the same response time in a page where you've got 5,000 people. Because if a social worker is only working with 10 children and another social worker is working with 40 children at the same given time, it means that their visits may be hurried, their observation may not be comprehensive, or their assessment may be too rushed as well because they've got a number of assessments to submit, whereas somebody is only submitting, say, five assessments the whole month or the whole 12 weeks, and the whole cycle of duty, they only have 10 assessments to submit, whereas the other cycle of duty, the other social worker from another patch of town is submitting 15, 20 assessments. That's just unfair on any level that you can imagine. So we need to be mindful about that. With these nuggets, I hope somebody has benefited from this, and I hope they've made an impact in your life, and you actually benefited one or two things, from this video. Thank you so much for watching. If you haven't subscribed, please subscribe and hit that notification bell so that when I post, you'll be the first person to know. I thank you so much. Salute.